your training should look very different in different chapters of your life. And sometimes you find that organically, and sometimes you find that by learning hard lessons like injuries. Hey everybody, welcome to the podcast. I'm Dr. Kirsten Wishloff. Today we're going to be talking about the change in identity that comes with injury. Really severe injury, and for the most part. And that can come in many different shapes and sizes, right? In my world, I predominantly deal with bones, joints, ligaments, etc., like quad ruptures, pec tears, things of that nature. Certainly you're going to require some sort of surgical intervention as a starting point, but I live in the land of rebuilding that body and redefining expectations, which is really interesting. And I don't know that we get a lot of formal education on this. It obviously exists, but there's a huge psychological component. And I think understanding behavior change, understanding goal setting, understanding identity and the role it plays in making an effective rehab program for someone who's suffered a really significant injury is super important. I have a couple thoughts too, just pertaining to more severe injuries when we're talking about limb amputations or spinal cord injuries. Things of that nature aren't directly in my world, in the world that I exist. Obviously, people certainly do that, physiotherapists, occupational therapists, and I think they actually would have a really great perspective on that because they're really on the front lines of that person redefining their identity. I obviously deal with that in smaller scale for the most part, but I certainly work with people who play para sport and have different, major injuries, and they're trying to regain functionality from that. So how do we do this? And I want to be sure that I emphasize to you guys, I didn't pull up papers on this. This is just off the cuff. So I would love if anyone has any input on this topic. If you're a professional, if you do research in this area, I would love it if you reached out to me. Maybe we can pop on a chat and discuss this through a little bit more. But I just want to talk through this from my perspective as a practitioner, my perspective as a person with, various people in my life having various forms of injuries. The thought that comes to my mind as just like a quick example where it wasn't me, it was actually my partner who ruptured his pec in the pandemic. Don't make me say I told you so. He was doing a lot of calisthenics, as a lot of people were at that time. And he slipped and he ruptured his pec doing a muscle up. He did end up getting it surgically reattached. It was a whole ordeal, but that was the first time that he had ever suffered an injury to that extent. And that was probably the first time that I was like the direct caretaker for someone who had suffered an injury to that extent. And in my mind, because I deal with injuries all the time, I was able to be fairly calm. But in his experience, and I obviously can't speak directly for his experience, but I think it was the first time in his life that there was an injury that was going to change the trajectory for his physical fitness from this point on. Now, looking back, what are we at? I think it was 2020 that it happened, 2021. So we're a couple years out. He has pretty much full function of his pec arm, full strength, bench press, pull-ups, no problem. But I think at the time it was a real moment of inflection and like a shifting into a body that is different than a 20-something-year-old body, which is actually one of my favorite client demographics to work with, is people who are transitioning out of highly competitive sport and trying to find their place in life and in training, because your training should look very different in different chapters of your life. And sometimes you find that organically, and sometimes you find that by learning hard lessons like injuries. I think if I were to share some tips on getting your head wrapped around the rehab process, it's don't compare yourself to a past version of yourself. move forward from wherever the starting point is. Yes, we obviously want to be tracking progress, but we can't set the comparison to what it used to be like. And I think that's where a lot of people get trapped in the idea that they're not making any progress, because their only perspective of progress is back to what it used to be like. And that is something that I explain to people all the time, especially if you are considering getting surgery for something and you're on the fence. I think, like in my past mind, I had a really bad shoulder when I was playing volleyball in my 20s, and there was this thought that maybe surgery would solve my problems. What I say to my clients today is surgery isn't a new shoulder. It is a different shoulder to rehab. And that goes for everything and anything when you're talking about knees or hips or whatever the case is. I mean, sometimes it's a joint replacement and sometimes it is a new piece, but it's not back to a previous form. It's into a new form. And I think that's something that you really want to get your head wrapped around when you are dealing with something that is really a large amount of damage. We're talking surgeries. We're talking big changes within your biomechanics. We can't think that any intervention at this point is going to take you back. We are moving into a new chapter for that joint, a new chapter in your movement. And we can always build up strength. We can always progressively overload. But we do want to understand that we are not looking back at what it used to be like before it was hurt, because that is real tough on the mindset, on the mental health there. But it also isn't going to continue to get you motivated, because it's never going to feel the exact same as it used to feel. So I think that is lesson kind of number one when I'm working with people with really big injuries, is we're not going back to a past version of yourself that occurred before this, existed before this happened. We're moving on to a new, different form. Hey everybody, just jumping in to let you know my 4-Day Fix program, a completely free 4-day online workshop, is just around the corner. This time we are going to be covering all things neck and shoulder. So if you are someone suffering from chronic neck pain, chronic shoulder injuries, or if you are a practitioner who works with clients and you want to clean up your methods when it comes to treating those issues, jump into my show notes and get registered for this free 4-Day Fix program. Back to the show. I think another conversation to have is goal setting for performance and changing kind of phases of goals as you're going through this process. Early phases have a lot of clarity when we're talking about post-surgical interventions, especially if we're talking like, a pec rupture or an ACL. All of these things have protocol-driven approaches up until a certain point. And when we hit that endpoint for the protocols, it doesn't mean you're back in action. It means we're safe and happy at the surgical incision, and now it becomes, let's structure a way to reconnect this damaged area in with the rest of the system. Let's make sure your brain and your motor control systems understand how to use it, how to have rhythm, how to have pacing with it. So when I'm saying stage it out, it's you'll read the 6 to 8 weeks, the 12 weeks, the 3 months, 6 months. Those early stages are based in the idea of cellular regeneration. So the actual timelines for cells to heal and local strength changes to happen. When we're talking about fascia and like the interconnected movement of your body is going to be repatterning itself for years to come off of any large damage. So yes, we can look at the timelines for recovery from damage in those short-term conversations, but when we're talking about longer-term goals, especially ones that are bigger than just activities of daily living, like I want to be able to go up the stairs, when the question becomes, I want to be able to squat X amount, or I want to be able to push this tissue, those conversations stretch out into the forms of years at a time. And I am really clear with people that those are the timeframes that we're working with, and that we're breaking these goals down to focus on different things at different stages. There's a time early recovery as well. So yes, we're focused on the cellular healing, but in early recovery too, I place a lot of emphasis on listening to the body, feeling where things are flowing, feeling how your body is compensating, feel how your body is controlling the force, and really observing if you are having a tendency to protect that area. That's the conversation that I have with people in those earlier stages of recovery, is how do we gain comfort, safety, control, trust in that area? And we really want to focus in on sensations in the body in those stages. When I'm working with higher level athletes, there needs to be a place, once we've proven that that area can be trusted, that it's strong enough, that it's integrated enough, there needs to be a time where we can turn off that hyper awareness of sensation and start to touch back into performance, start to touch back into focusing on performance, focusing on output, focusing on those things. And there's a time where that can happen, but we want to be cognizant in that first part to really observe sensation and movement so you gain that awareness of if you are compensating. Once we've actually had time to recondition your tissue, it's not going to be terrible if you have compensations. And if you have structural damage, there's a good chance that you're actually going to have structural compensations that occur as the result of something getting hurt, right? If you have an ankle fusion, that ankle's not going to move normally and those forces are going to travel somewhere else. But when we have this time to bring awareness to how your movement is happening, we also progressively overload the areas of compensation, which means we get them stronger. So there isn't a huge problem with having compensation, but we want to make sure that we've allotted enough time to have strength in those areas that are compensating. And we also want to make sure that you are aware and purposefully redistributing that force, because if you are not, it's going to show up somewhere where you're not expecting. Usually it's going to be the lower back, the neck, the shoulders. Things are going to travel into other areas if you are not consciously distributing them somewhere else. So there's going to be timelines for really observing and and I don't want to say hyper aware, but very aware of how your body is controlling movement so that we can structure the force rebuilding, the force distribution rebuilding systems of the body, and then start to, again, bring yourself back to a place where you can just focus on output and not super stress about how your body is gathering, collecting, and distributing movement in your body. So it's not a forever. You don't have to overthink things forever. You do want to understand that there's going to be stages and chapters. And once you've gone through that awareness phase and you've pushed into performance, I think about it as, when we're periodizing with weightlifting, there's times where you're building up to a plateau and then you're pulling back, kind of reestablishing the assisting muscles. You're trying to, rebalance things, and then you're going to build back up. When we're talking about a large structural damage, a piece of large structural damage in your body, I like to think of it as the same. So we're going to rebuild some movement patterns, and we're during that time of these rebuilding, we're also establishing, how much can your body tolerate. We're testing, we're calibrating out how much your body can manage, and then we're going to push into those edges. We're going to find out where those edges are. We're going to see where the breakdowns happen, and then we're going to go back into that rebuilding and awareness phase, and we're going to patchwork some of those areas where we're falling apart, and then we're going to build back up, test again, and then we're going to continue to grow and press on like that. So that's actually how we're going to get a hold of higher levels of performance. But when we're talking about structural damage, there's going to be this rhythmic change that we need to observe. We can't just go more forever. We have to see where the body is compensating. We have to see where the breakdowns are happening. And yes, on this chat today, we're talking about catastrophic injury, but that goes for any type of injury, really. Is your body is going to change how it feels that area, how it trusts it, how it loads it. And so we want to be aware of that and make sure we're structuring that into our training. When we're going back to something like sport or performance, we definitely need to be able to turn off that hyper awareness of sensation. But in the interim, in the early stages, we want to make sure that we are bringing awareness to that movement in a productive way. A couple ideas for you to think through, but understand that when you go through a very large, significant injury, it comes with a lot of psychological challenges as well. And know that that's par for the course. I would really encourage you to work with a practitioner that you feel confident with. If you're a practitioner listening to this, I encourage you to be the type of practitioner that emphasizes that mental health side of things. One of the worst things that I always see is people will see practitioners, medical doctors, etc., that catastrophize the injury, we can never load it again. We can never do this again. And the language that they come from is a place of, removing all potential. I find that to be really challenging to work with when you're incrementally trying to expand someone's capacity to start from a place of you can't do anything. Obviously there's a time and place if it's unstable, etc. But you want to be working with a team that is providing you with reasonable next steps and providing you with hope for what the future looks like. Because if you are left feeling like you can't do anything, it becomes really hard to keep going on that rehab process because it's real slow and really has its ups and downs. So I would really encourage you to match up with a team that makes you feel optimistic. It explores a lot of different options of things that you can do. And it leaves you feeling like there's a plan for progress. I'm going to leave you on that note. If you are a practitioner, really be sure to clarify timelines with people. Don't make them short and quick because they will not be short and quick. Set smaller goals and try to check things off the list that maybe don't necessarily have to do with pain, but have to do with function. And make sure that we are staying realistic, but staying optimistic. And the way that you stay optimistic is setting realistic goals. So that would be my suggestion for a practitioner. If you are a client, again, just find the team that makes you feel like they have things under control, makes you feel like there is a plan for the future, and you leave with the feeling that you're supported. That's going to be the biggest thing, because with very large damage, it comes with a big shift in identity or expectations for what your body is going to be able to do. So once again, I did not reference papers. I'm not a psychologist. I help people with rehab, but know that there's a huge psychological component to it. I would love it if you guys have any great resources to share on this topic, or you want to contribute to the conversation. Always shoot me a message. Thank you for listening in today. And I hope if you are someone who has dealt with a very large injury or any sort of, substantial change in the function of your body, that you have a team around you supporting you, because it is a lot to go through. So know that you are not alone, and there's a lot of resources to help you out. All right. Have an excellent rest of your day. Thank you for listening in.
Once again.